You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know about compression garments. With us, we have an expert on this topic. She has a lot to say about compression garments, Dr. Leslie Giesemann. Dr. Giesemann, welcome to the program.
Thank you very much.
Now, compression garments.
Yes.
Who is supposed to wear them?
Almost everybody can wear them, actually.
Okay. And there's benefits?
There are benefits. A lot of people don't understand the benefits, so that's why a lot of people don't wear them. The people who really need them and have been referred, generally they will try to wear them, but I find that a lot of times they don't know exactly which ones they should use.
Okay, so I have limited knowledge in this particular topic. If somebody, so for example, my friends that do, we've had you on the program talking about vein disease.
Right.
So people that have had some type of leg work or diabetes or ulcers or whatever,
Right.
I know that they wear compression garments.
Right.
But who else
Right.
wears compression garments?
Athletes.
Really?
Yes, athletes. It's a very big source of people that wear it. I mean, you have the baseball players, football players, the professional athletes.
But this is off. That means not when they're playing. They're wearing it
When
in
they're
the
playing.
Okay. What's the benefit, though? I'm still not clear on what it does to the body.
Well, what the benefit is that it actually improves the muscle function because you're getting a lot of the buildup products, the waste products, away from the muscles so they can play longer.
Interesting. So it's pushing, like for example, if you're wearing it around your knees or thighs, would you wear it that high or where would you wear it?
The optimal is to wear it from the foot all the way up to the thigh.
Okay.
So that would
So
be
the
optimal.
lactic acid or whatever
Yes.
is pushed out so they can exercise longer potentially?
Yes.
Is that right?
Yes, and that's why it's used. There are arm sleeves that can help the arm. They come in multiple different types.
Okay, now this is a bit of a setup question. The problem is they don't look good.
Well, they don't look good unless you get them from me.
Because you told me on the phone that you have I'm paraphrasing you, but it's like the most attractive or the
Right.
most beautiful
Right.
compression garments in the world.
Right. Well, what I have done is I see a lot of patients, obviously, that need them. So I have gone through and I have determined which ones work as well as which ones are attractive. Because I was finding even with my own patients that I would tell them they needed something. They'd go and they'd get measured. They'd go through several different people before they got to the garment. Then when they came back to me, they said they were ugly, they were too tight. So I decided to get rid of those middle people so that we have them and we can determine the best fit for them and we can determine which ones they like.
So what makes them so attractive? I mean, they come in a bunch of different colors? Or?
Colors, the actual fabrics. We have multiple different fabrics. We have wool and bamboo. We have cottons. We have multiple different weights and different strengths, different weaves.
So who's wearing these, by the way? Now, we talked about, though, athletes and things like that. But who are the patients that you are seeing? And do you have to wear them forever?
Well, what I find is if I can get patients to be compliant and wear them for kind of an extended period of time first during the beginning, then we can stretch it out so you don't have to wear them all the time. But many times they want to wear them all the time because that benefit that they get, they really notice when they're not wearing them.
What about summertime?
We have great summertime ones. We do. We
that
honestly
right?
do. We do. We have actually footless garments. And so I have a lot of my ladies that will wear flip-flops and they'll want to go to the beach, they'll have on a dress and they'll have a footless garment that actually has the compression.
So they feel better. So people with tired legs
Yes.
or have a tough time standing in one place for a long time,
Yes. And
they benefit the most?
Well, they benefit, but also people who don't have those problems. So,
Do you wear them?
I do.
Is that right?
Yes, I do. When I'm in the operating room, I have other scrub techs, anesthesiologists, different people that are on their feet, kind of on your feet profession wear the compression. So,
Is that right?
Yeah.
And so would you say, are there tens of thousands of people wearing these?
There should be.
Are they like Spanx? Do Spanx have that kind of a benefit?
Spanx are different. What
they're
Spanx?
upper mid-body?
Right. And sometimes I don't recommend wearing something super tight around the mid-body because what you're doing is you're compressing and you're overcoming that system that's a low pressure system, which is the venous system. So if you're wearing something super tight, super tight, super tight, you're not allowing the blood flow to return to your central circulation. So you can actually develop varicose veins and those types of problems.
So Spanx, by wearing Spanx...
I don't want to say Spanx per se, but some
Spanx,
type of tight compression garment.
I could say Spanx. So Spanx can lead to varicose veins.
Potentially.
Is that right?
Yeah.
Now, so with these lower, now you wear them.
Hmm.
You think you could? I mean, do you exercise with them and
Oh,
you
yeah.
do everything with them?
Oh, yeah. We have different compression strengths. And that's one of the things that people don't understand. They think a compression garment and they just go and buy the first one that they see, and they say, oh, this should be my size. I'm going to buy this one. But there are different compression strengths. You have lower strengths that diabetics can wear because they have vascular disease as well as need, compression for their veins. We have slightly more compression strengths that, say like your average mom may want to wear just around because it makes her feel good and it gives her energy during the day, or someone that's sitting and interviewing people that would wear something like that. Then we have it all the way up to the more medical grade.
Do you think I should wear them?
Yeah, I do.
How do you know that I'm not wearing them right now?
Well, you could be.
Right? No, I'm kidding. But but I feel like it's something. Then once you start doing it, there's that much of a difference.
There is a
you're
really
stuck wearing them forever. And are humans supposed to be? Is this like cheating the system in a way?
No, actually, what happens is when I see patients in my practice, they're at the end stages a lot of times.
Okay.
And so they come to me and they say, when I was younger, I didn't really have this problem. Yeah, I'd have some swelling. After we ferret out, like, well, did you have this? Did you have that? Well, yeah, I noticed kind of this or I noticed kind of that, but they never did anything about it. So then we get them when they're at the stages where they really have to wear them forever, and it's something that they can't, get rid of.
So you have all different types of colors, things that they could go out in.
Oh, yeah. We have one of my big things that I tell my friends is that we have, for men, say they're getting married, they're in a wedding, they're going to be on their feet all day, and most of the women will change dresses and things like that, but the guys are in their tux, they're in their shoes, and they're stuck. So by the end of the evening, then they feel better. And one of the little tricks that I do is if I don't want to wear compression hose, I'll actually wear my compression hose all day before my event, because when is the event? It's at night. So I take it off before I go to my event. So I've gotten rid of a lot of that edema that would actually accumulate during the day. And then I can walk around at the end of the night. I'm the only one not taking my shoes off.
You seem a pretty lean person. Like you don't have swelling. You're doing it just for the health benefits of it.
I do it for the health benefits, but actually it is noticeable. I did not think that I had swelling, but everything that comes into our store, I try on. So I try everything on. So one day I was on call. I had on a thigh high and I had on a sock. And by 9 o'clock at night, I've been running around doing all the stuff I do. I take off both because I'm going to go to bed. And I was standing in front of the mirror and I was like, oh my goodness, one thigh was smaller than the other thigh. And it was because I had my compression garments on. So, there is a noticeable difference. And women who want their legs to look leaner can actually see that benefit.
So if you're going out in a short dress or whatever, you can wear them all day and they will be noticeably shrunk.
Right. And then you don't get that swelling because most people, when you go out, it's already the end of the day. And then you're out until, 11, 12 o'clock at night. And then by the end of the night, every woman has her shoes off, at least in the car on the way home, because their feet are swollen and their legs are swollen. So you preempt that so that you have that period of time where when you don't have the garments on, it would be like starting out in the morning, so that you don't have that edema.
So do women, so for example, because I guess wearing high heels, I know with my wife it could be difficult for long periods of time.
Right.
Does it help with that?
It actually can help some. I've worn heels, and we just had a talk at my office, and I had one thigh high on and the other I didn't. And I could tell a noticeable difference with high, I don't even remember how high my heels were, but probably about 3 inches. I could tell a noticeable difference.
So do you have a retail outlet?
Yes, we do.
And where is it?
It's on Miramar Road, and it's called the Standing Sock.
The Standing Sock. It's hard to believe that it's that busy of a business.
Yeah.
There's that many people.
There are a lot of people. We get referrals from physicians. We get people that come in. We get athletes that come in looking for garments.
So the patients are getting healthier and healthier that are doing this. So the word on the street is,
this is the thing.
You should probably try it.
Yeah.
Cyclists.
Yeah, definitely. Especially the weekend warriors, because they're the ones that are kind of on the cusp, and this will help with their longevity, with them exercising, so they can actually exercise longer and better.
So you're compressing the muscle area.
Well, you're compressing more the subcutaneous tissue, not the muscle.
And it forces, and it's taking what part out? Fluid?
Yes.
Lactic acid?
Yes.
which
Yes.
is with the athletes that builds up
Right.
and causes fatigue and soreness.
Right. It aids
very
the
interesting.
superficial venous system in returning. You have two systems in the leg. You have the system that's the deep system, which is inside the muscles. So as you're exercising, you're actually pumping that muscle system. So the venous return there is usually pretty good. But the superficial system is the one that's aided by the garments because it also helps get that fluid return.
And how much are they, by the way? Like from the low end?
About $15, $8 to $15, depending on if they're, what compression strength they
It's not
are.
very much. So how much?
All the way up to,
The best ones?
Yeah, well, an actual measured compression garment that I have to physically measure a patient for can be anywhere like $200, but those are custom garments.
Are they covered by insurance? If you
If you have
diagnosis?
something that requires a custom garment, it is covered.
So if you've been diagnosed with type 2 diabetes or vein disease?
Unfortunately, they're not covered in that sense. Lymphedema garments, which we do have those as well, can be covered, but everybody's policy is different. So depending on what your policy is. But your health savings account, those kinds of things can be used.
Now, I feel like I hear a lot of things on this show. You know, we air all over the U.S. and Canada. For the last 15 years, I've interviewed doctors, but I've never heard anything like this. Could anybody argue, could an expert argue, I don't think healthy people should be doing this because maybe it messes up with the detoxification or lymphatic system of a healthy person? Because if you stop wearing them, could there be extra buildup of these things?
It's not really extra buildup.
So nobody argues that this isn't a good idea?
Well, I mean, they're medically proven. All of the garments that we have in the store currently are FDA approved for what they do.
So nobody, though, nobody says could be dangerous?
I'm sure there's probably someone out
You've
there
never
that
heard
says
it, but
it.
you've
I
never
haven't
heard
heard it.
So everybody should try it.
Yeah, I think that it's something that people should try. And basically, they need to know what compression strength, and that's, But we have them, like I said, for diabetes, for multiple different types of disease processes.
So like if I have to go to Disneyland with my kids, I get a pair of these. I'm going to feel so much better.
Generally, you don't get the swelling from walking around.
Well, I don't get swelling anyway, but what I'm saying is will I have more energy?
You don't think you get swelling.
Will I have more energy?
Yeah, a lot of times.
So that's what I'll know.
Yeah, their feet are much more comfortable.
Okay, good. Well, I want to thank you for coming on the show.
Sure.
So they can visit on the website. Do you have a specific website?
Yeah, we do have a
for this?
website for that, and it's
what
the
is that?
Standing Sock.
The Standing Sock.com. And they can order them there.
Well, they can call. We're getting it together so that they can order right off
good.
the website.
Well, thank you for coming on the show.
Thank you.
You've been watching The Wellness Hour. I'm Randy Alvarez. We'll be right back.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.